The global vaccine rollout now is well underway. This is a massive mobilization. We're seeing some of the world's wealthiest countries, including the U.S., members of the European Union and the U.K., begin their immunization drives in a big way at an urgent time. The virus continues to advance. We've seen new variants emerge that are cause for concern. But at the same time, vast numbers of countries around the world have yet to start their campaigns. And so in a way, the world is splitting into two tiers. And even when these developing nations and middle-income nations begin administering doses to protect their populations, the progress could be slow. Now, no matter where you are in the world, this is important because the public health and economic implications here are significant. Public health experts note that as the virus continues to spread in large parts of the world, unchecked by vaccines, inevitably infections would rise and new variants could emerge. There could be a greater risk of new variants and more contagious versions of the coronavirus that could pose problems for governments and also have implications for the vaccines and the therapies that have been developed. So public health authorities and vaccine advocates will be working hard to tackle these disparities in the coming months. Now, we've seen the arrival of highly effective vaccines from Pfizer and Moderna. Now, this has raised the question of whether the rest of the world will have access to the same level of protection because wealthy countries have largely bought up the Pfizer and Moderna doses. Now, with the vaccines that are on their way to the developing world and the rest of the world, experts say that even if they don't attain the same level of efficacy seen in the late-stage trials from Pfizer and Moderna, that when it comes to preventing severe disease and death and hospitalizations, they could be comparable. So that will be important to keep an eye on because experts are concerned not just about access to vaccines globally, but access to highly effective vaccines. So we'll have to keep a close eye on that. Now, there are also ambitious global efforts underway to tackle these problems. There's a program called COVAX that aims to deploy vaccines equitably all over the world, but there are growing concerns about whether COVAX will have the vaccines it needs to meet global demand. The head of the WHO just warned that, in his words, the world is on the brink of a catastrophic moral failure if it fails to solve this problem. So the urgency is growing, the level of concern is rising as the death toll surpasses 2 million and the pandemic heads into a new phase. So the coming weeks are going to be crucial.